Hello, my name is Dr. Andrew Dawson from the Dawson Microsurgery Clinic in Hartlepool. I want to share with you my experience and knowledge that I've gained over 15 years of practice on post-vasectomy pain, or PVP. First of all, there are a number of uncertainties amongst the medical profession as to what PVP is. Some professionals will think it's pain caused by a granuloma or from a trapped nerve at the site of the vas, or some psychological cause. Some papers will say that 1 in 6 patients who've had a vasectomy will have some degree of post-vasectomy pain, and I want to give you my experience on this. The nature of post-vasectomy pain is very variable. It may come on within 6 weeks of having a vasectomy, it may come on within 2 or 3 or even 4 years. But it's almost always a chronic relapsing testicular ache, a sort of nagging ache that can come on after sex. It can come on immediately after sex and is a cause of concern to marital guidance counsellors, but more commonly it takes some days to start. The duration of the pain may be for 3, 4, 5 days, and then it spontaneously improves. And typically patients will suffer it for a while, want to seek help, but then it gets better, and so that they ignore that problem. So there's a spectrum of severity of pain and involvement in my view, and I know because I've had the PVP myself. And I think there's no doubt about the cause of this pain, and it follows vasectomy that's been caused in any way. The technique of vasectomy is not important in the causation of post-vasectomy pain. And my opinion is that the pain's consistently caused by distension of the epididymal tubule after the obstruction caused by vasectomy. It's a build-up of fluid and distension and pressure in that epididymis. This diagram shows the anatomy before and after vasectomy. Here we have the normal testis, which is unchanged following vasectomy. This grey area here shows the outline of the epididymis, and in reality, underneath here is a supercoiled, very narrow, very thin-walled vessel in which sperms mature. And from the end of the epididymis starts the vas. It starts as coiled, and then it goes up into the body in this direction. Now, the vasectomy obstructs the vas here, causing an obstruction to the outflow of fluid and sperms from this point here. And that causes this thin, soft-walled epididymis tube to distend, and it can frequently become quite large and be irregularly shaped, as this purple outline shows. And in my opinion, this is the cause of post-vasectomy pain. Now, the treatment is straightforward. It's to release the obstruction here to allow the distended epididymis to deflate back to its normal size, thus alleviating the pain. So PVP, or post-vasectomy pain, has a spectrum of severity. In some people it's quite mild, and they may only notice this when they cross their legs or put on some tight jeans. But on the other end of the spectrum, this can be a life-changing, severe, chronic depressive pain. And the good news is that the treatment modality that we use here at Dawson Microsurgery is vasectomy reversal. It's highly effective. More than 23 out of 25 patients we've treated here have been cured of that pain by reversal. There are many other treatments that have been tried and suggested in other centres. Psychiatric medicine, believe it or not, removal of the epididymis, opening up the vas again, have all been tried, and these are ineffective, inappropriate treatments in my opinion.